Okay, this is part 5 of Erasing Dr. McDougall's Legacy, Dr. Walter Kempner and the Rice Diet. So Dr. Walter Kempner was one of the main mentors of Dr. McDougall. Him and Nathan Pritikin were probably the two most important mentors. It was Dennis Burkitt, though, back in around 1971 that got him started realizing that diet could turn your health around. So you eat the high-fiber diet, as Burkitt spoke about, and your abdominal problems, most of them are all prevented, most of the common ones, okay? And then what Kempner did is he took these people with severe hypertension back in the 1940s, people who were expected to die on average within 5 months, and he routinely reversed their blood pressures, brought them back down to normal from systolics in the 200s. They used to call that malignant hypertension. Okay, and he also found that he was curing all his type 2 diabetics. He was often reversing diabetic retinopathy, hypertensive retinopathy. Is extraordinary. You see their eye grounds on their retinal exam return to normal. Congestive heart failure patients, you see their heart shrink back down to normal. Frank Nealon, who later took over the Rice Diet, him along with Dr. Rosati, he saw patients with pulmonary hypertension getting better. And I'm going to show you a picture of Frank Nealon in a little bit here, but Frank Nealon said it was extraordinary to have trained previously in internal medicine and have experience in endocrinology where the patients never get better, to all of a sudden work with Kempner and all these patients routinely are being cured. That's what you see when you look at the low-fat vegan diet. It's extraordinary with no oil. It's extraordinary. There's nothing like it. It's the most powerful thing in medicine. The reason it's the most powerful thing in medicine is because that's what humans are designed to eat. Now here's a diagram. This comes from a Dr. McDougall newsletter, December 2013. You can just go to Dr. McDougall's website, drmcdougall.com, and you can find this newsletter, December 2013. The reason I'm showing you all this stuff is so you don't become a chump. Because all these high-fat phonies, the moderate-fat vegans, I call them, they're really sort of like the vegan version of the Mediterranean diet. They're trying to trick everybody and say, oh, you need all these good fats, and then you need more protein when you get older, all this BS. And I'm trying to, if you're anchored in understanding the history of Pritikin, McDougall, and Kempner, then you won't be a chump. Dr. McDougall had said, don't even challenge me or question me about nutrition until you've at least read Kempner and Pritikin, okay? Because if you haven't, then you really don't have the basics and you're not really ready to have a serious conversation about nutrition. And what you're going to see when you look at the Kempner diet is extraordinary cures. Reversal of coronary artery disease, okay? Reversal of congestive heart failure, reversal of diabetic retinopathy, hypertensive retinopathy, people losing 100 pounds, their blood pressure suddenly just dropping, their blood glucose level rapidly coming back down to normal, okay? It was extraordinary. There's nothing like it in conventional medicine, okay? And, the low-fat vegan diet is the only one shown to reverse coronary artery disease. So it's extraordinary. The Blankenhorn studies of reversing atherosclerosis. Whatever fat you ate, the atherosclerosis got worse. It didn't matter what type of fat it was, okay? Pritikin was shown reversal on angiograms of atherosclerosis. McDougall had seen it. Esselstyn had shown it as well. Dr. Ornish had shown it on SPECT scans. Okay, so it's extraordinary what this diet can do, and it's because it's what humans are designed to eat. We got our flat teeth, and the whole story. Okay, so anyways, I'm showing you this so that you'll be locked in and strong. You won't be mentally weak. You won't cave in whenever somebody says, oh, you need to eat the latest BS, good fat or something. All right, so anyways, I'll show you a couple more slides, and then I'll give you the link to the video. It's a long interview between Dr. Nealon, who took over the Rice Diet, and Dr. McDougall. It's a great interview. Let me just get myself in the corner. This is just a picture of the Rice houses. The people would go to the Rice houses, and they would all sit together at the tables and talk to each other. They'd all have to weigh in front of each other. It was a public weigh-in. The people who lost over 100 pounds had their picture on the wall. They'd write their blood pressure on the wall. So it was very public, okay? And Kempner was a little bit rough with the patients. He said, look, if you don't want to follow the diet, go home, get out of here, don't come back, okay? This is for serious people who want to get better, okay? And Kempner would also expect them to follow the diet, just like he said. He's like, look, I know this diet works. I don't know if you make changes to it. I don't know if it's going to work. When you're here, just do the diet, okay? Okay, and that's, again, what it was. It was rice, white rice, fruits and fruit juices, and a multivitamin. And then for patients who needed to gain weight, he'd give them table sugar, and that's it. He wanted, to get protein as low as possible because protein's bad for the kidney. He wanted to get fat as low as possible because fat causes hypertension and it also causes diabetes. Okay, he wanted sodium as low as possible because sodium also causes high blood pressure. Okay, and high blood pressure leads to atherosclerosis and it's bad for the kidneys. Okay, here's a picture of Walter Kempner, and again, he sort of made Duke University a famous place. There was no dialysis back in those days. There weren't any good antihypertensive medications back in the 1940s. So people would fly from all over, the USA, including from other countries, to be treated by Dr. Kempner. Okay, lots of celebrities went to him back in the day. Okay, and he noticed all kinds of incredible things. He was also curing psoriasis patients. Okay. Somebody asked Kempner, did you ever have a patient lose over 100 pounds? He real quickly found over like 106 patients who lost over 100 pounds. Okay, the average weight loss of this patient group was 141 pounds. He's got tons of photographs of all these people losing over 100 pounds, reversing coronary artery disease, normalizing these systolic blood pressures of 200 and over, normalizing EKGs. Here's normalizing their retinal exams. Okay, this is extraordinary stuff. You won't see this anywhere else in medicine. It's unique. And luckily, Dr. McDougall, Frank Nealon is an old guy. He's about 88 years. I don't even know if he's still alive. The interview was from a couple of years ago. I think it was from 2 years ago. Dr. McDougall at the time then was about 75. And here's EKGs being reversed. So Frank Nealon had the books of Dr. Kempner, and he gave them to Dr. McDougall, who then had them scanned into a computer, so they're now available. If you go to Dr. McDougall's website, drmcdougall.com, you can see the Kempner books. The first one's like in German largely, so you won't be able to read it unless you speak German. The second one's in English, though, and you can read it, and it's excellent. It's really worth reading. Okay, the Barbara Newberg biography of Kempner is also great. And like Frank Nealon said, you have to see it for yourself because it's so extraordinary, all these patients being cured. You have like an epiphany that this is the right way that medicine should be practiced, that it's actually possible to cure all these people. Okay, because until you see that, conventional medicine, you just shuffle the pills and the patients really don't improve much. It's kind of like a big game, and then they get sicker and you give them a different pill. It's kind of like a big joke. Okay, here's a patient, their heart size normalizing. Okay, this is just a little more of this stuff like we were talking about, the details of the diet. Here's a couple quotes that I thought were pretty good from Frank Nealon in the interview. I'm just getting you warmed up, so when you watch the interview, you'll get the key points real fast. The interview is going to have a lot more information than this. Okay, so this is Frank Nealon. He had the epiphany by working with him. This is Dr. Rosati, who also managed the Rice Diet for a while. It finally was closed by Duke in 2016. They make too much money selling pills and surgery, so they didn't want to keep going with the Rice Diet. Let's see, what did he notice else? Kempner would get their daily dietary sodium down to 100 milligrams per day, which is, the vast majority of people tolerated that just fine, but some people would have a problem. Very rare, you can have something called syndrome of inappropriate ADH secretion, where they can't concentrate their urine and they're losing sodium in their urine, so they can't be on that low of a sodium diet. Some patients also are on diuretics that cause more sodium excretion in the urine. You have to stop those diuretics. Some patient had a colectomy, and that was a little bit of a problem because from the diet, some of the sodium is absorbed into the body through the colon. So if their colon has been shortened by surgery, they might not get enough sodium if they're only on 100 milligrams per day. Population in the wild is probably going to be eating somewhere like 250 to 500 milligrams per day, in that ballpark. Frank Nealon thinks 500 to 700 sodium milligrams per day is a reasonable amount, but Kempner really wanted it lower because Kempner's opinion was you hit a threshold effect. The lower you get on the sodium, you get more benefit from doing it. And he had people who were, at high risk to die with systolics in the 200s. But the point of all that was if you're going to really eat this low of a sodium diet, you should be in a partially monitored setting. When I say monitored, I mean like on the Rice houses in Durham where they could check your blood sodium, they could check your urine sodium. Let's see. Fruits are very low in fat and very low in sodium. They're relatively high in potassium, which is a vasodilator. Kempner started out treating patients with severe hypertension. And he would, once you put them on the Kempner diet, their blood pressure just drops like a rock. You got to get them, nowadays, you got to make sure you get them off their hypertensive meds real quickly. Same thing with their blood sugars. They just drop like a rock. So you got to get them off their diabetic meds real quickly. And this just goes to show you what a joke it is treating with pills. When you can drop people's blood pressure like a rock and drop their blood sugars like a rock with diet, why mess around with a pill that you have to pay for and take every day of the rest of your life and go to the pharmacy? It's stupid. And you're still going to have complications, side effects of the pills, and irreversible damage from the chronic insulin resistance. Why not just cure the disease? Okay, let's see what else. Kempner diet, like you said, in general, it's about 90% carbohydrate, 5% fat, 5% protein, but you could get it higher. You could get this as high as 94% carbohydrate. Nealon points out, Dr. Nealon, that the patients are diabetic because of their high-fat diets, not because they're fat, because you could immediately reverse their diabetes by removing the fat from the diet, but they would still be obese, and it would take more time to lose all the body weight. So that was a key point. If you do liposuction, that doesn't help the patient, okay? It doesn't help them with their diabetes. Exercise helps for health, but it doesn't help for weight loss, was the experience of Dr. Nealon. For patients with serious health problems, Dr. Nealon felt that it's very helpful to measure portion sizes, especially early on with the diet. Again, these guys took over the diet after Kempner was retired, but it closed in 2016. Dr. McDougall has a couple great comments during the video. Again, the diet was just white rice, fruits, fruit juices, table sugar, and for patients who need table sugar for patients who need to gain weight and a multivitamin. Dr. McDougall says moderation is a slippery slope. It does not work. Okay, again, I'm going to have the link to the whole interview between Dr. McDougall and Frank Nealon in the description below. Here is the percentage of fat in different foods. For example, white rice, should be in here somewhere, white rice, potatoes, sweet potatoes, they all have only 1% of calories from fat. So you eat that stuff, you lose weight really fast. Okay, and the friends of mine and the patients I've seen that actually follow the diet, they lose weight pretty fast, and they're very happy with it. Actually, my girlfriend, since she's been hanging around me, she says, I keep losing weight. I don't know if I want to get any skinnier. Anyways, there's plenty of omega-3, omega-6 fats. You get all the essential fats you need just from eating low-fat plant foods. Don't let anybody tell you you need supplements. McDougall's talked about this extensively, so has Pritikin. So anyways, I think that's the last slide. I'll have the link again in the description below. Oh, and I got a couple more slides. This is just a quick reminder about hypertension. So systolic is a number on top. Diastolic is a number below. Kempner was treating people with terrible systolics, up over 200. Again, red blood cells are 7 microns, capillaries are 5 microns, so they have to deform as it is a little bit when you push them through. If fat sticks these red blood cells together, then it's harder to push them through and you get hypertension. The higher your LDL cholesterol, the higher your blood viscosity, and the more hypertensive you're probably going to be, the more at risk you are for atherosclerosis. Red blood cells have a zeta potential, a negative charge on their outer surface. Same thing with endothelium, same thing with white blood cells. Bridging molecules are big enough and positively charged on their outer surface that they can stick red blood cells together. And once they do that, the blood becomes thicker, higher viscosity. Pumping pressure has to go up. LDL cholesterol does that. Chylomicrons do that. Fibrinogen clotting protein does that. Uric acid does that. IgM antibodies do that. Okay, this is blood sludge when you got the red blood cells stuck together by the bridging molecules. Now you're like pushing a sandwich through there. You're pumping a milkshake up to the top of the brain to get it to your cerebral cortex, pumping against gravity. So you're pumping a milkshake instead of pumping water. Blood pressure has to go up, especially then too if you vasoconstrict the system with sodium. And then when you have high blood pressure, it starts bouncing harder off these median dividers at bifurcations, and that damages the arteries and causes atherosclerosis. In my atherosclerosis lectures, I go over all this stuff in much more detail. Nitric oxide is the most important thing produced by endothelial cells. It goes into the arterial wall, and it causes vasodilation by relaxing the muscles. It's a gas. It also diffuses into the lumen of the artery and helps the platelets to not clot. It's anti-clotting. Okay, that's a good thing. Okay, your body keeps the total amount of cations, positive ions, constant, and it goes by sodium and potassium to a large degree, meaning that there's a fixed constant, the amount of potassium and sodium you have. So the more dietary sodium you eat, the more potassium you're going to piss out in your urine, because the body's more designed to excrete potassium than sodium. So that dietary sodium that you eat, the more dietary sodium you eat, the lower your potassium is going to go, and potassium functions essentially as a vasodilator, sodium as a vasoconstrictor. So you really don't want to be going high on your sodium. And Richard Moore, who spent his whole life studying these plasma membrane ion pumps, he said you want to be at least 5 times higher. I think our ancestors probably routinely were 20 times higher in their potassium than their sodium. He calls it the K factor. If you can at least keep your K factor above 5, you probably won't have a problem with hypertension if you keep it lifelong. If you've already been hypertensive for a while, you probably lost the Wink-Kessel effect in your ascending thoracic aorta, and you got other arteries that are calcified, less functional. So you want to get your ratio higher, But anyways, probably at a minimum, I would say probably keep it at least 10. Anyways, there it is, the K factor. Okay, and that's all I got. I'll have the link in the description below to the interview between Frank Nealon of the Rice Diet, who took over from Kempner, with Dr. McDougall. It's a great interview. It's very useful. It's very insightful. And once you see these things, you'll understand why you want to be low fat.